This is INCRadio, DZEM 954, the voice of truth, the official radio station of the Church of Christ or Iglesia ni Cristo.
SVC Tech, SVC Tech,
CEK in the Silicon Valley.
Cali SVC Tech, SVC Tech,
Technology, entertainment, and knowledge.
Tech Off.
Hello, welcome back to another episode of INCRadio, Silicon Valley, California. Brother Miggs, doesn't look like a chapel.
I know it doesn't, but we're here at a very special place because we're here because we're doing something. And I think for those in the comments can't tell already, we're doing a very special episode because we're learning how to clean teeth and also what is dental hygiene.
Yeah. Hi, I'm Brother Glenn from the local congregation of Salinas. My other host.
My name is Brother Miguel, and we're not here by ourselves today. It's not just me and Brother Glenn talking about teeth, but we actually have two very special panelists that will be here today. Let's kind of get to know them. Welcome, welcome, welcome.
My name is Brother Paulo Jimenez. I'm from the local of Fremont.
And my name is Sister Jerica Hippolito. I'm from the local of San Jose, and I am a registered dental hygienist.
All right, thank you so much, Sister. I'm just kind of like wondering, what is it like being a hygienist, and what do you do on your day-to-day?
Yeah, so I have been a dental hygienist for 3 years now. I really love this profession, especially if anyone is curious about entering this profession. I feel like a lot of people might get confused with what a dental hygienist is and what a dentist is. So just to put it short, a hygienist does mainly focus on preventative care. So prevention is always better than treatment. And then the dentist then focuses on restorative care. So getting anything fixed up that, for example, cavities and things of that sort.
All right.
Yeah.
That's cool. Good thing Paulo's here because when was the last time you brushed your teeth, Paulo?
Yes, yesterday.
Yesterday? What? Okay, good thing we're here. It's just thankfully Sister Jerica will kind of go through a hygienist cleaning. Jerica, what do you kind of expect? So for those that are watching at home, this is kind of going to be like a quick demo, right? Of like what a hygienist is going to go through for cleaning. Yeah, love to share it. Yeah,
We'll have
For
some
sure,
discussion
for sure.
portions,
Yeah.
and then we'll have like a little demo of what it's like to be at a dental visit. Is that the correct term?
During your dental cleaning.
Dental
yeah.
cleaning.
Or
dental
new patient visit.
Patient visit.
Yes, yeah.
Yes.
Let's take a moment to get Brother Paulo all ready.
Yeah.
We're going to put this patient bib on for you.
All right. Yay.
So
he's
it's
getting clean
official. I normally would have gloves and all the PP. So
teeth. It's okay.
yeah, so
What is PP?
PP is like all the protective wear that you're wearing. So sometimes you'll see them wearing like a gown. They
Yeah.
have like a face shield.
Okay.
We have our fancy glasses.
Yeah.
But yeah, so what can you expect during a dental cleaning? So especially for a new patient visit, we take what are known as dental radiographs or x-rays. This basically helps us to diagnose the patient and to see what might be going on their oral health status. During that visit, we also do an examination of their gums. This also allows us to see how the health is, if there are any signs of disease.
Okay.
We take a look at any, for example, dental decay, any signs of infections. But to basically run down like through a general dentist cleaning, you take x-rays, we do an oral cancer screening, we do a perio exam, which is to see the health of the gums. And then the dentist will come in at some point to also, they're the ones who will do the official diagnosis of everything.
Yeah.
And then the dental hygienist will do the cleaning for you.
Ooh, that's a lot. Yeah. Brother Glenn.
Sister Jerica, you mentioned X-rays, right? We are SVC Tech Talks. Can you kind of go over some of the other technology you would use maybe during a dental visit?
For sure. And especially since we're talking about advancements with the technology, I'm sure some people in the viewers, you probably remember the old school dental X-rays, where we had films, and then you would have to basically go into a dark room and develop them. But thankfully now we have much more updated X-rays. So when we take X-rays, it basically shows us different densities of inside the mouth. So for example, you'll see the teeth structure and also the bone structure. You'll see different densities. So you'll see some areas that might look darker, some are lighter. And basically, through those dental X-rays, you may see darker spots, which would suggest signs of decay. You might see like little white bumps in between the teeth, which would suggest signs of calculus formation underneath the gums.
Calculus, whoa. I didn't know there's
Yeah.
calculus.
That's a math class. Different calculus or tartar. But yes, it's a good tool in helping diagnose, but also for patient education.
Okay.
Yeah.
Gotcha. Got it. Well, let's read some of the comments that we have for today. We have some viewers that is joining us tonight. Hello, po, live from Milpitas, and then that is how did I? Hello. Okay. And then we also have from Renia. Hello and good evening, po, everyone from South San Jose. And then we also have another one. We have from Brother Daryl. Happy viewing from local Oakland district of Bay Area, California. Hi, boy.
Hi, Kuya Daryl.
Kuya Daryl. Thank you so much for watching for today. And then there is another one. Woohoo! Excited for tonight's broadcast. Brush your teeth. That's from Renia. Renia, of course. So if you have any questions or anything that you wanted to ask Sister Jerica, here's the great time to ask, and make sure you type in your name, your local, and also just any questions you have in regards to hygiene care and also any teeth care. Yes, so love to learn more.
Sister Jerica, you mentioned as a dental hygienist, you're more about preventative
Yes.
about, like, let's say dental diseases and things of like that nature.
Yes.
Do you have any like tips or tricks that you would kind of give to anyone looking to take better care of their teeth?
For sure. So starting off with just the basics of recommendations, I'm curious to know in the chat, how often do you think it is recommended to visit the dentist for your dental cleaning?
Oh, that's a good one.
Let's see if
That's a good
anyone
one. How
has-
often do you go into the office?
Yeah.
Mm.
Let's see if we have any
Let's see
answers.
any answers. If there's any answers in the chat. Oh, looks like let's kind of read off from the chat right here. Looks like they don't know. I don't know. Oh, we see it 2 times a year.
Okay.
From Audrey. Let's see if there's any
Nice.
twice a year from Sister Rochelle. Every
Okay.
every 6 months.
Yes.
That's twice a year as well from Sister Irene.
Okay.
All right. Sister Nikki, Custodia said twice a year. So it seems like it's twice a year.
Yes, correct. I think we need to give
Okay.
them some free floss after
Oh,
this.
some
But yes, that is correct. So it is typically recommended to go to the dentist for your dental cleaning at least twice a year. There are cases where some will go more frequently, but that is for maintenance if you have, like, for example, gum disease. But as far as tips, I think the basics for home care is to brush your teeth twice a day, so morning and the nighttime. To floss, ideally at least once a day. I prefer at nighttime. And yeah, just being on top of your dental visits to catch anything before anything becomes worse.
Got it. So, for those that are watching from home and also like us, I'm curious, like, what is the proper way to, brush your teeth and take care of your teeth?
For sure. So I will grab my little friend over here.
Ooh.
Live demo.
Yes, a little model here. So there's various ways to brush your teeth. I think also it depends what tool you're using. So if you're using a manual toothbrush, it'll look a little bit different. And if you're using electric toothbrush, you will kind of tweak it a little bit. But if you are using a standard manual toothbrush just like this, your goal is to first start along the gum line. What you'll do is angle it about 45 degrees towards the gum line. The reason being, I do see a lot of people miss that spot, and that's typically where a lot of that plaque will hide. So when you first angle it there, you can do a back and forth motion, but I do like a more circular motion. And tip is to do gentle pressure just to prevent any damage on the gums. And then you would kind of go up towards the teeth surface. And then if you're going on the biting surfaces, you can just go back and forth. And then right over here, I'm not sure if you're able to see, right on the inner side of the lower front teeth, this is a common spot where you typically get a lot of buildup. You can also just go back and forth. Now, with an electric toothbrush, it may look a little bit different because the toothbrush itself will already be doing a lot of the work. And what you'll be doing is basically guiding the toothbrush as opposed to scrubbing really hard. So you, in essence, you'll be tracing along the gum line, letting the toothbrush do the work, and then just guiding it to the surfaces that you need to cover. So,
Got it. You're taking notes, Paulo? Wow. Hopefully, yeah, so we'll be able to use it. You can use
I'm
that.
curious out there, are there any like foods that cause a lot of buildup or cause a lot of like cavities that maybe we eat like pretty often?
for sure, lots of starchy foods, so like crackers, cookies, all of our favorite foods, even gummies, candies, sticky foods. Those are typically the foods you want to stay away from if you
Got it.
can.
Okay.
But I also love all those foods.
Yeah, you kind of just described what I've been eating for the past few months or year.
No, it's okay. I feel like in moderation, it's all right.
Yeah.
Yes, for sure.
So, okay. So we have some questions from the chat. Let's kind of read it. From one of the questions was from from Juan. What is the best vitamin for teeth? Ooh, I don't know.
Yeah, I would say in the dental world, we typically recommend fluoride, which
Okay.
is in your toothpaste. Sometimes when you go to the dentist, you have a varnish that's applied to your teeth. That basically helps to remineralize the teeth.
Ooh, okay.
Because whenever you eat food, there's a bacteria in your mouth that will basically cause acid to form in the mouth.
I see.
And the goal of the fluoride is to help to strengthen the teeth and to remineralize it.
Oh, got it. So I feel like being able to take care by using fluoride, which is a lot in, I'm assuming toothpaste and all those dental care
Yes.
kits. That's what we be using. Typically, how many times is the best way to brush your teeth? A day.
It would be twice a day. So morning and nighttime. And people typically ask as well, should you brush your teeth before breakfast or after breakfast?
Oh yeah.
Yes. So it's recommended to actually brush your teeth before breakfast because overnight time, a lot of bacteria forms there, and you want to brush that off before you eat any food and consume
I see.
anything.
Okay.
However, if you do want to brush after breakfast, it is recommended to wait at least 30 minutes because again, when you eat food, you have that acid exposure, and then you don't want to brush the teeth while they're at a weakened state.
Oh,
Yeah.
got it. I have a quick question. So just a question personally. What is your thoughts on like whitening, teeth whitening? I know that we see when I see really white teeth or like when teeth is like, whitened, I think I know that it looks very, very pretty. It looks really good. But then does that mean it's healthy?
Not per se.
Oh,
I will say we have a lot of patients that will probably come in and they are more interested in, for example, teeth whitening over getting like a cleaning, right?
yeah.
And I think a wider smile doesn't necessarily mean a healthier smile. I will say it's more for aesthetics. And as a hygienist, we do promote the health before anything.
Got it.
Yeah,
Okay.
so if you do want to whiten your teeth, there's nothing wrong with it. It'll look beautiful.
Yeah.
But I think it's just like a little cherry on top. But
Okay.
yeah.
I see.
Ate, I know before you've worked with kids, right?
Yes,
And I'm
yes.
sure a lot of us have a little bit of fear going to the dentist. Do you have any tips for like parents who maybe have kids who are a little bit fearful in going?
Yeah.
sure.
Paulo used to be afraid of coming to the office all the time.
I think he's afraid right now.
Yeah, he's afraid right now.
Yeah, and I can speak on that because I, as a kid, had the biggest dental anxiety. If you ask my parents and my family, I was so scared of the dentist. I think I even kicked my dentist, which is another
Hey,
story.
Paulo, careful,
Um,
careful.
But yeah, I would say for any children who have dental anxiety, the key is to bring them as young as you can, especially when that first tooth erupts,
Yeah.
just so that they can already get used to the environment. They'll feel more comfortable and kind of get the sense of the routine. Also, for the parents, if you allow the kids to kind of build that confidence with holding the toothbrush at home, kind of guiding them, then when they come into the office for the first time, it won't feel like it's something completely new.
Yeah.
Another thing I like to do when I have children patients is I like it to be interactive because there's all these things, the lights, the instruments, they don't know what it is. So for example, I have the mouth mirror, I'll show it to the kid and I'll be like, I have a tiny mirror, do you want to touch it? And they'll look at it and they think it's so funny. And then I'll get like my other instruments and I'll be like, I'm going to spray some water and then like just make it interactive. So I would say if you go into a dental office, you can let the hygienist know, hey, can you be interactive and explain everything? That might help the kid feel more comfortable.
Oh, okay, got it. I honestly need that too. I need it to be interactive. I get kind of scared actually whenever I go to get my teeth cleaned. I'm always scared because sometimes it does hurt, when you get your teeth cleaned. And I'm curious. I know before a couple years back, I didn't really floss as much, and my teeth will bleed. I'm curious, why is that?
Yeah, so when you do not floss regularly,
Yeah.
or if you're not brushing too well, you might be leaving some plaque on the teeth.
Mhm,
The
mhm.
plaque, if it remains on the gums, it will cause inflammation to occur.
Oh,
And we often get asked to like, oh, I'm bleeding because I'm flossing, but it's you're bleeding because maybe you're not flossing well enough or you're not getting those spots. So you'll notice that the more you do the flossing, the bleeding will actually go away. So I know it's not the funnest task to do, but maybe we can make that our New Year's resolution to floss
okay.
more.
Especially now that's coming up for New Year's.
Yes.
Yeah. Do you have any recommendations when it comes to floss? I know that there's the string floss and there's also the picks as well. Is there any recommendations from a hygienist perspective?
Yeah, I'm curious for the viewers as well. What kind of floss are you using? There's so many different kinds. There's like the traditional string floss. There's the flosser picks with the little handles. There's also water flossers. All of these are great tools, and I think I will just say if you're using something, it's better than nothing, right? But for me personally, I do like string floss. I like something like this, which is like an expanding floss.
Okay.
So it pulls the plaque a little bit better. And I do think that string floss is able to clean a little bit better if I can just demonstrate really quick. So this is what is known as like a C-shaped flossing method. You would wrap the floss around the middle finger here, and then you would use your pointer and thumb to get a good hold of it. So what I notice, a lot of people will only floss straight up and down to remove food, which is okay, right?
Okay.
But the best way to clean is you're going to wrap it around the tooth like a C shape.
Oh, that's why it's called
Yes,
C-shaped
and then you're
method.
going to scoop
Oh, okay.
below the gum line and up the tooth. You're going to go about 3 to 4 times and then flip it to the other side about 3 to 4 times.
Oh, okay.
Yes, so sometimes when I see patients and they say they're flossing every day, but it's still bleeding, it might just be they're not going low enough to clean what's below the gums.
Oh,
Yeah.
that's what the C-shaped method?
C-shaped flossing method,
C-shaped
yes.
flossing method.
Actually,
Mhm.
Dr. Jericho, I believe we actually have another health question right there on the
Yes,
bottom highlighted there.
yes.
It says, "Hi, Sister Jerica. Please provide some tips for people who grind their teeth while sleeping." Hashtag
Awesome.
Milpitas.
That's a great question. Actually, in my office, we have a lot of people who grind their teeth, and some are not even aware of it. So we actually take intraoral photos in our office because with the light, you're able to see there's fractures or like you'll see these vertical lines that show there's a lot of pressure being exerted on the teeth.
I see. Yeah.
So grinding your teeth or bruxism is in result to stress or fatigue. So different ways to help with that. You can't really restore it besides like getting bigger treatments like crowns, but you can
Okay.
prevent it from getting
So
worse.
preventative is the main-
Preventative, yeah. So some offices will have night guards. So if you don't wear a night guard already, it may be a good idea to look into that so that the night guard you would wear at nighttime, it'll take all the stress as opposed to your teeth hitting up against each other.
Okay, thank
Yeah.
you so much for who asked that question. So night guard and just being preventative.
Yes, I will also add that I've had some patients who even the night guard, it doesn't work too well.
Yeah.
You can also get Botox on the TMJ to loosen up the muscles.
Oh, okay.
So there's several options out there for you.
I see.
Mhm.
I see. So we're kind of going towards the end of the broadcast, unfortunately. But Sister Jerica, do you have any last minute tips or anything that you would love to share to those watching from home? Anything that
Yes.
just any tips that can come to your head?
For sure. I just want to go back to the topic that I mentioned earlier of the best vitamin for your teeth, which is fluoride. I also am aware that not everyone wants to use fluoride, which is okay. So there are also alternatives, which is the nanohydroxyapatite toothpaste, which might be a good alternative for some families. It is a little bit on the newer side as opposed to the studies on fluoride. What I do know, it is recommended to have at least 10% for that toothpaste for it to be effective.
Okay.
So that's another thing to consider. But I just want to give a reminder, if you haven't had your dental cleaning yet this year, please schedule it before the
Yes.
year ends. And please never feel ashamed when you go into the dental office. I have a lot of patients come in and they're so embarrassed of their teeth and their condition. They haven't gone for many years or, before COVID. I've had them come for the first time.
Yeah.
Truly, we've seen it all and we're not going to judge you. We really want to help you to get to a better state. But yeah, feel free to ask us any more questions. We'd love to continue on in another topic, but yeah, we're here to help.
Dental hygiene part 2.
Part two?
Yeah.
Okay. Thank you so much. Well, thank you so much, Paulo, for being the model here. Yeah.
Thank you so much, Ate Jared,
Of
for
Thank you so much.
course, so
giving
much
us your
fun.
wisdom.
Yeah, wisdom. Actually, Paulo has an appointment here tomorrow. It's amazing. I'm just gonna leave you here, Paulo. No, but we like to say thank you, especially to the audience, and of course, we like to thank Marzan, Mayet Marzan, for letting us be here in her dental hygienist or dental office. We're very thankful for you, and especially wanted to say happy birthday as well.
Happy
Because
Yes,
birthday,
let's say
happy
some happy
birthday,
birthdays in the
Paul.
chat because it is her birthday today. All right. So now we're gonna go transition now to some of our past activities and upcoming activities that is happening in Silicon Valley. If Kuya Tech can pull up the materials, we have some of our past activities. For here, this was some of the past activities that we had. One of them was actually the Family Fun Day, and this was across the district. Let's kind of go through some of the photos. You can see here that there's a lot of people gathered here, and this is from Fremont, Mountain View, San Jose. You can see all these photos that all happened over the weekend. We can go to the next slide. You can see here, this is from the local congregation of Fremont. We had a lot of food. We had golf. We had some video games, Jenga. And then for the next slide, we have from the local congregation of Gilroy. They had an outdoor family fun day. I think they played some. What is that on the board, on the wooden board? Is that what is that called? Ski? Is it ski walking or something? I don't know. Someone in the chat can correct me, but it looked like a lot of fun. Looks like a lot of fun. All right, we can go to the next slide. In Milpitas, they had a lot of board games, some video games. Are they playing Roblox down there? I don't know, but they had darts, some fun games as well. Looks like they're doing a lot of board games for this locale. And then in Monterey, they had I think is that stacking, cup stacking, speed stacking. Oh man! And then they also had some balloon games, just a lot of fun with the kids as well. In Mountain View, they had a bunch of they had is that an ice cream bar or like coffee bar, or they played cornhole as well. And matcha, they had matcha. Wow. So I wish I was there. All right, so if we can go to the next one, we also have for Redwood. Redwood was able to they had a lot of fun. They had they had a lot of food, and also of course Jenga. Yeah, that was a really big hit for a lot of the locals within the district. My locale, Jenga. Redwood had Jenga, And
Oh,
then Salinas, that's
yeah.
you.
Yeah, we played tug of war. I beat Coach Charles in tug of war. I just wanted to say that. We also played chess. I also played Scrabble with a lot of the booklet sisters. They do not play at Scrabble. I was beat twice. Shout out Sister Gina Ramin for teaching me Scrabble.
Oh man,
That's my tangent. But overall, it was fun. There was barbecue, hot dogs, and yeah.
Oh, okay, that looks like fun. Maybe we can have her on the air.
Oh, yeah.
Play Scrabble together.
Scrabble 101.
Scrabble
Sister Gina.
101. All right, and then this is the local congregation of San Jose. Yes, they had a huge turnout. Looks like there's so many different booths. They had some booths with balloons. They had some games for the kids. Looks like even for the booklet as well. Looks like they even had a tug of war. I think I saw on some of the photos. Looks like they had a lot of fun there too. All right, and then for South San Jose, they had cup stacking again. I think that's a popular activity. And also they had some of the booklets there. Some of the booklets participated and even played some of that game. I think where you blow up a balloon and try to blow the cups off the table. I think that's one of those games, those minute to win it games, you know. Yeah. And then if we go to the next slide, we have our last one, which is Union City. I was actually there too. They had a bunch. They had karaoke. They had Beyblade, and they had Connect Four. They even had pickleball, which is a big thing in Union City. That's what they're known for. They love playing pickleball. I was playing with Kuya Jabin actually that weekend.
Yeah.
So yeah, thank you so much. It was been a fun episode.
Yeah, very much so. Before we wrap up, Brother Mix, does the panel or any of our hosts want to give a
Yeah, do
final
you have
shout out?
any shout outs that you like to give out before we kind of close things off?
Yeah, I'd like to give a shout out to actually all the brethren who are in dental. So especially in the room with us, Brother Austin is my fellow hygienist with us, with Austin Marzan.
Shout out to Brother Austin.
To all the hygienists, dental assistants, dentists, front desk, everyone who works in the dental field. Hello, and I support all of you.
All right, Brother Paulo, do you have any thing you want to shout out?
I just want to shout out for the video as always.
Okay, thank you.
I also want to shout out my family and then also brethren in Fremont as well. And then also, yeah.
How about you, Brother Mix?
Just want to shout out, of course, those that continue to watch us and always tune in every Friday night. We love to hear your feedback and, of course, your recommendations and suggestions. It's going to be a new year coming up for 2026, and Silicon Valley INCRadio, we have so many plans, but of course, we want them to be included with your thoughts and your feedback. If you have anything that you want to share, any topics that you would like to be seen, like for example, we have dental cleaning was one of those topics that was recommended to us. We love your guys' feedback and we love to hear from you. And if you have any comments or anything, please share in the chat. We'll be happy to hopefully include them for our next broadcast.
Yeah. First of all, for wrap up, shout out to this wonderful panel. Shout out to Jared, Powell, Mix. It was an amazing broadcast. Shout out our tech and shout out always INCRadio. Shout out Mom and Dad. Hi, Mom and Dad. Love you. And shout out to our Almighty God for broadcasts like this.
Yes. So now we're going to be wrapping up with our conclusion.
Yes.
We have our ways to tune in and keep up with church media. We have our YouTube at INCRadio DZEM 954. Please share the link and subscribe. We also have our social media, Iglesia Ni Cristo News and Updates on Facebook. We also have our Instagram at INC Media News and Updates. We'd like to thank our church administration, our executive minister, Brother Eduardo V. Manalo, our deputy executive minister, Brother Angelo Manalo. We also like to thank our Silicon Valley district leadership, our district supervising minister, Ka Noel S. Gasmen, our assistant district supervising minister, Ka Jason Dulalas, our CFO overseer, Ka Mark Anthony Manuel, and our multimedia advisor, Ka Francis Valencia. We also like to thank our INCRadio tech from the Philippines, Korea Tech, Brother Manly, Brother Wally, our station manager.
You know how we end off every episode of INCRadio, Silicon Valley, California Tech Talks, right?
Yes.
Okay. All right. I'll count it off. Thank you for watching another episode of
INCRadio,
Silicon Valley, California.
All right. Thank you so much for tuning in. Alaska's episode right after.
Thank you. Brush your teeth.
Brush your teeth after this episode.